Hello, greetings. It's Brent McGinney, CEO, President of the Missouri Behavioral Health Council. Good to be with you. Wanted to say thank you for attending the conference. We sure do wish we could have been there in person, but over 700 people attending virtually is quite a deal, and we appreciate you doing that for us. Hope you had a good conference. Hope you had a good time. We missed being with you in person. I'm coming to you this morning from the Annex office of the Missouri Behavioral Health Council. We're experiencing some growing pains because of all the great work you're doing, all the work we're trying to do to support you. So come to you from the council's Annex office near downtown and near the Capitol. So happy to be with you. We also, because we're not in person, we don't get to see you and you don't get to see my staff. And so probably know, but some of you are new. But my staff at the leadership level consists of Rochelle Glavin, who is VP of Clinical Programs, Chelsea Hughes, who does all things administration as our Director of Admin, and Mark Schwartz, our Government Relations Liaison. So he does a great job at the Capitol. But with that, we're going to kick it over to some of our directors who also want to introduce their teams. And so for Cindy, Tara, Katie, and Natalie, give them a chance. So again, thank you. Really appreciate you. Really appreciate all you do. Take care.
Hi, my name is Cindy Davis. I'm the Director of Health and Community Services for the Council. We'd like to thank you for attending this year's conference. We really hope you enjoyed it. I'd like to introduce you to my team. Our team focuses on the integrated care model with healthcare home, community integration with outreach services, hospitals, community partnerships, crisis services, workforce initiatives, and so much more. First is Kimberly Hicks. Kimberly is our Missouri Crisis Intervention Team Manager. Kimberly works closely with the State CIT Coordinator, Detective Jason Klaus. Together, they coordinate the statewide CIT initiative, the local CIT councils, the annual CIT conference, bringing together our first responders from across the state. Kimberly has a great working relationship with law enforcement, including police departments across Missouri, Missouri Sheriff's Association, and Missouri State Highway Patrol. Casey Rafferty. Casey is our Community Integration Manager and works with the Community Behavioral Health Liaison Program, or better known as the CBHLs. Casey also works with the upcoming and established crisis stabilization centers around the state. She also provides support to the Cultural Equity, Diversity, and Inclusion Committee and is assisting with the implementation of the independent assessment. Casey brings a wealth of experience from the Office of State Court Administrators and Children's Division. Ashley Jenkins. Ashley is the Integrated Care Manager for the Council. She focuses primarily on Healthcare Home Program, the Disease Management Initiative, integration projects, and work with the Medical Directors Committee. Ashley partners with the Department of Mental Health's Integrated Care Team, Missouri Primary Care Association, and the Medical Directors Group. Ashley is here to help teams navigate through policies and procedures, work with the Care Manager platform, and to help answer any questions your teams may have. As for me, I work with your emergency room enhancement teams, partner with the Missouri Hospital Association, the Missouri Department of Corrections, as well as our community colleges and their associate degree programs in behavioral health support. Thank you again for joining us at our conference, and we look forward to seeing you next year in St. Louis.
Hello, my name is Tara Crawford, and I'm the Director of Health Information. We hope you enjoyed the conference. I would like to tell you a little bit about our data team here at the Council. We work on a variety of data and technology projects, along with your agency's data and leadership teams. Drew Burnett is our Quality Improvement Manager, whose main objective is improving the quality of care provided to clients by gathering and providing data to your teams who can use that data to look for areas of improvement in the programs. James Barber is our Data and IT Manager, and he manages all of our technology needs here at the Council. He also monitors the various data feeds that are used in our care coordination and population health solution, Care Manager. Our team also provides training and support to those who use our technology systems. We've enjoyed working with so many of you, and please do not hesitate to reach out if we can be of any assistance. We hope to see all of you next year in St. Louis.
Hi, my name is Katie Forsman, and I'm the Director of Education and Engagement for the Council. We'd like to thank you for attending this year's conference. But before doing so, I would like to introduce you to my team. Our team focuses on training, billing, continuing education, social media, and marketing. We are so happy to work with you throughout all of our events. Emily Condi is our continuing education manager. She works on multiple trainings and conferences. She also works on all our continuing education as well as continuing medical education certificates for our training and conferences. She is always there to help everyone, and we appreciate all the hard work she does to make our events successful. Kelsey Meanwasser is our billing and engagement coordinator. She also helps with coordination of events, trainings, and conferences. In addition, she helps with the billing on the back end. Kelsey is a blessing to the council and helps us keep organized, on task, and assisting our providers with anything they need. Chelsea Skidmore is our media coordinator. She does all the graphics, videos, and social media for the council. She did all the intro videos and graphics for this year's conference. She is very talented and really takes our events and social media to the next level. From all of us, I would like to thank you for making this year's conference a success. And we hope that you enjoyed the virtual experience. Join us next year in person at the Union Station on September 7th through the 9th, 2022. Thank you.
Hi, Natalie Cook here, Director of Prevention and Recovery at the Missouri Behavioral Health Council. Thank you so much for attending this year's conference, and we hope you enjoyed the virtual experience. Our conferences take a lot of behind-the-scenes work from the council staff, and I would like to introduce you to the Prevention and Recovery team. Our team focuses on suicide prevention, crisis response, housing initiatives, substance use disorder treatment and recovery, and state and federal behavioral health policy. Nicole Lee is our Zero Suicide Coordinator. Nicole supports the Missouri Suicide Prevention Network and Missouri Zero Suicide Initiatives. Michaela Youngmeyer-Greger is our Prevention Services Manager. Michaela also supports the Missouri Suicide Prevention Network, and she manages new statewide housing initiatives and is a member of the 988 planning team. It is our pleasure to work on behalf of council members, the Missouri Suicide Prevention Network, and individuals with behavioral health needs in Missouri. Thank you for making this year's conference a success, and we hope to see you September 7th through the 9th, 2022 in St. Louis.